Good morning, 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 and happy Easter to everybody who celebrates. Happy Easter to everybody who don't celebrate, and then happy off day to those who are off because of Easter. Um, Another interesting week, a very, very, very interesting week, a very solemn week. As the U.S. reaches number one, we're leading the world in deaths and cases across the board with 378,000 cases that are confirmed and 20,601 confirmed deaths as of 20 seconds ago. With that being said, nearly 18,860 across the world are dead from the coronavirus, and that leaves the U.S. in rather of a bind. Bernie Sanders drops from the U.S. presidential race, suspending his campaign. Joe Biden, with that being said, introduces a new health care plan, and he also introduced a new student loan forgiveness program for low income workers across the country who have accumulated student loan debt. What's going on? Is this a double pandemic for African Americans? Or is this just a single pandemic that is just hitting African Americans harder? So let's talk about that. What's going on now in the world? First payments of the stimulus package, the package that's called CARES stimulus package number one, which was the $2 trillion package that everyone was waiting on. First payments are going to go out this coming week and the next week for those who have set up direct deposit stemming from completing your 2018-2019 federal taxes. So those who completed 2018 federal taxes and even put on direct deposit payment information will get theirs theoretically this coming week. Those who filed the 2019 and set up their direct deposits should get that later in this week and in the beginning of next week. There is a website, and I'll post that in the comments and links section down below on my YouTube page and also on my podcast page. So if you are unable, or if you're a low income person who does not file taxes, there is a website that the IRS has just rolled out Friday evening, where you are able to insert in direct deposit payment information even if you do not fill out taxes. So that is coming. What does this stimulus package entail for small businesses? Because as we have seen in the media and in the news, a lot of these small businesses are being turned down. So here are a few pointers for those small businesses who are in need of some of these loans. All of these loans are, as of now, first come, first serve. If you apply for it and you are approved, with certain many credit restrictions as normal. If you are going to be approved if your credit score is high enough. I'm not quite sure what credit scores they're looking for. Haven't really researched too far into that. I'm not a small business. I don't know many people on my platform who watch that own small businesses, but they are saying that if you go directly to your bank, or through whoever you receive most of your line of credit through, then you should more than likely be approved for these loans that are, as of now, only holding about a 7 or 8% interest rate. So now would be the good time to do it. Unemployment has reached a new record high at 14.7%. So we're slowly creeping up to that 23% unemployment rate that was going on during the 1940s, 1930s, slowly creeping to a depression. There are still 526,000 people that are still being put on hold, essentially, that are being delayed because of certain telecommunication problems, because of the very, very, very old unemployment system that wasn't expecting such a high rocket in cases and in calls and things like that. So unemployment is reaching a new all-time vast high, and states and the federal government aren't able to keep up with these claims. Like I said, 500 and some thousand people are still waiting to even put in their unemployment claim. What people are saying, and what experts are saying, and what Politico is saying, Politico.com, which is where I receive most of my information. They're saying keep trying, keep hitting refresh. If it doesn't crash and you know your internet is working, just keep hitting refresh. You will eventually get through. The worst case scenario, give them a call as early in the morning or as late in the evening as possible. So you want to try to focus on off-peak hours if unemployment is something that you are attempting to receive. So just think, when everyone else around you is asleep and you're up, that's when you need to be trying to get online and file for your unemployment. Because it's going to just get rougher and rougher as more things start to close down and more people start to depend and rely on the unemployment system, the food stamp system, things like that. Bernie Sanders has dropped out of the race. He has suspended his campaign. I am extremely disheartened by that. I am a Bernie Sanders supporter to the core. I am a socialist to the core. And a lot of what Bernie Sanders stands for, I believe in cold-heartedly and passionately, and I'm there for him. So I hate to see him drop out of the race again. But with that being said, it does look like Biden is going to be our next Democratic presidential nominee. In a way to kind of coax over those Bernie supporters and bring them over to the Biden camp, Joe Biden has introduced a new student loan forgiveness program that will eliminate up to $25,000. Those are the preliminary numbers now. That will eliminate up to $25,000 for those who have accumulated student loan debt and for those who income household is less than $125,000. It's also a new Medicare for All program, and it's not even necessarily a Medicare for All program. That's what he calls it. It's just decreasing the Medicare age limit because as of now, you have to be 65 years or over to pull out things like retirement or 401k without being taxed and applying for Medicare. So Joe Biden has introduced a plan that will enable senior citizens who are 60 years and older to actually apply without penalty for those 401k pension releases and for Medicare. He hasn't released financial details of that yet, but from what a lot of us are understanding on the political side of things is that it's going to follow the Elizabeth Warren plan, and her plan was Medicare, Medicaid for all, and she was going to mandate that the federal government pay for these things. Which was her financial plan. She said there's the money for it, kind of how Europe does it with their free healthcare service, things like that. She wants to bring that into the U.S. But doctors and private hospitals are throwing backlash at those two particular plans. Not yet on Biden's plan, but on Nancy Pelosi's plan, because this plan, as people know and as I've discussed on this platform, not every American has health care. So with that being said, not every American pays their bills. So even though the government is going to pay a big portion of it, they're not going to pay all of it. We'll be left with co-pays, deductibles, things like that many of us aren't going to pay. So that'll leave a lot of these privatized hospitals and many of these public hospitals in despair because of these two packages. So we'll see if Biden is going to come out with something different in the coming weeks. We shall see. Outside of the U.S., in China's company BYD has now been FDA approved to create and ship KN95 masks and respirators to the U.S. About 30 years ago, in the economic trade war, China was essentially banned, not necessarily banned, but I'll go ahead and say banned. China was essentially banned from sending such products to the U.S. As far as medical equipment, medicine, things like that, because America says that these things that China uses them for would have different purposes in the United States. For example, in China, it is legal and it is okay for you to use a mask over and over and over again for many different patients. Just as well as in the United States, people didn't know sharing needles was a bad thing. So in China, China's still on that. Hey, yeah, we know these are bad things, but if for the good of the public, if it weighs out better, then we're going to do it. So that's their mentality, and that was what that big blockade was coming from China. And a lot of people didn't know that. Hey, why is China making these things and we don't have access to them? Well, that's why. The U.S. has theoretically higher standards for what we could use inside of the country, even though a lot of this shit end up killing us anyway. Who's to say? Protests have outrisen outside of the United States as well, in Israel and Brussels. In Israel, they still cannot come together on a common government party. Because people don't want to give up power. The Israel prime minister could face corruption charges because he has essentially handpicked every single court, supreme judge, whatever they call them. He has handpicked each and every single one of those. So this man has been prosecuted several times by many different people inside of the country, but has been able, since he controls the actual judiciary system of the country, he has been able to kind of push those back. So a lot of people are pretty upset, and they are starting to protest in Israel because they are attempting to create a democratic society, but they are unable to because the blue and white party is fighting against the current prime minister who doesn't want to let go of power, and he's diminishing the blue and white party little by little by inserting all of these regulations and all of these party ground rules, and restricting money flow into that party, which is going to be another big issue when he finally does come to court. Probably looking at some crimes against humanity there, because a lot of people have died during these protests. Many people who have spoken out against the prime minister have been arrested, and no one's heard from them yet. So several families, says Politico.com, several families have been without their family members for about 2 to 3 weeks since protests have began to uprise in Israel. Moving on to Brussels, violent protests have come out in Brussels after a protest began over the environment. People were upset for climate change, so they were protesting against it, mandating that the government actually create regulations. That coal company that we talked about the other day that finally just came out and said, hey, maybe we are having something to do with these ozone issues. Maybe there is something greater and deeper going on. So a 19-year-old who was trying to escape the protests and calamity actually crashed into a police barricade, leaving him dead and several others dead. And then from there, violent protests have hit the streets because why did they need to kill this 19-year-old man if he didn't kill any of your people? So that's the bigger question of it all. But coming back over to the US, what's the deal? Many people were saying that this has become a double pandemic for the African American community, starting in the 1980s, where most of these cases are happening. New York, Chicago, New Orleans, where blacks are most likely to die from HIV and AIDS. We're seeing the same repertoire here. We're seeing the same thing go on in these cities where blacks and African Americans are starting to be the #1 death rate inside of the country. And why is this, you ask? I believe myself it's because most minorities, we'll just go ahead and round it about, there hasn't been testing in these minority populated areas because most of these areas hold essential workers. The more of us blacks and the more of us Mexicans and the more of us minorities that they test, the more and more cases will populate, and then the more and more people will have to be out of work. So right now, the essential workers, because we are essential, are not being tested. And that's the same repertoire we were seeing in the 1980s. This morning, Magic Johnson himself was on CNN.com he was on actually CNN, and he was stating that misinformation is the main cause. At first, everyone thought that HIV and AIDS was a white man disease, and then it came out that coronavirus was a white man's disease, and the poor people didn't get it because poor people didn't travel. But that is completely opposite. So says death rates and things like that. As of now, of the entire population, 17.5% of the 378,000 cases of coronavirus in the U.S., 17.5% of those are minorities. And I believe the more minorities we begin to test, just the same as HIV and AIDS, the more minorities we begin to test, the more and more cases of this virus will start to appear in these minority neighborhoods. And what's the deal with that? Why are we as minorities allowed to spread it among other minorities and more essential workers versus testing? Why don't we have testing in these areas? It is very difficult, for a New York example, for someone who lives in the heart of Harlem. To get all the way down to Manhattan or to get to downtown or the Meat District in New Orleans. It's hard for people to leave New Orleans, period, to get to Baton Rouge and places like that where a lot of the testing is going on. And then to go, and none of these people you're able to communicate with effectively because you do not see yourself in the healthcare provider that you're being provided to. And that's a problem, and no one is coming out or addressing these issues. No one is coming out and addressing these problems. What's up with the disparity against minorities? If we are essential workers, then treat us as if we're essential. I believe that testing should have started with hospital and healthcare workers first. Why aren't hospital and healthcare workers being tested every single day that they come in? Why isn't the testing available? Why are communities who are more likely to see a rise in these cases, why aren't they being tested at all? Call your senator, call your congressman, and demand these questions be answered. Stop the spread of misinformation. No, it's not just a white rich man's disease. This is a nigga disease too. So with all of that being said, call your senator, call your congressman, because I haven't been tested, and I'm pretty sure many of you on this platform haven't been tested, let alone even knowing where to go to be tested properly. That's an issue that no one has even spoken about, and truth be had, it's rather sad. Departments are being strapped. The health department, which is going underfunded and undereducated and just under everything for the past 20 years since the privatization laws have come into effect. How are we running out of test kits already, and why haven't those test kits reached the poor? That's all I'm saying. Why do we have to go so far to be tested, and then when we're tested we're turned away because we're not showing many symptoms? But as many of you know, most African Americans are asymptomatic. Most minorities are asymptomatic because we're used to getting up every day and dealing with the cold and dealing with the flu and things like that because we have to go to work, we have to make money. That's just a major issue, and I don't want to wing too far on the left on this platform about it, but if you do want to talk about it, we could talk about it later. New York hospitals are due to run out of testing kits this week. That's sad to say that only the rich people really have been tested, but it's just madness. Coming back over into the U.S. after all of that's been said, because I'm getting kind of upset talking about it. Democrats are introducing a CARES 2 package. Right now, the Democrats didn't receive everything that they wanted from the first CARES package. They did get in the stimulus bill for the unemployment, extra 6 weeks, things like that, up to an extra $630. But with Donald Trump wanting to win this upcoming election, he's essentially fighting for grapes right now. And when I say that, Donald Trump, as for what it seems, is being totally bipartisan from the first time ever throughout his entire almost 4 years in office now. So essentially he's given the Democrats everything he wants, says Nancy Pelosi on Politico over the week. They want in this CARES 2 package, $250 billion package. This isn't a $1 trillion package, but $250 billion just for small businesses, because we see that a lot of the small businesses that we have in the country now are held by minorities, and who is going to be less likely to receive a loan from their bank? Minorities. So with that being said, Nancy Pelosi has introduced into the beginning part of the verbiage of this $250 billion that's strictly set aside for minority small business owners. Extra food stamp times for those who are unemployed right now. The food stamp maximum, I believe, is 6 months. Nancy Pelosi has introduced verbiage to take food stamps up to a year for those who are directly impacted by this. And then open community health locations, which is what we've been needed in minority areas, because a lot of the issue is that with urban areas, since urban areas are more densely populated, they're saying that it's harder to ramp up testing because of the space that'll be needed for testing without getting everyone sick. That's the bullshit ass excuse that they're using for not testing minorities. There's not enough space. That's the excuse. You can research CNN, political platforms with good information. The main excuse is, hey, there's not enough space to even build a testing facility. There's not enough space to even build a healthcare facility. So Nancy Pelosi has introduced this into legislation. Final legislation for this bill is due to come out 4/20, my favorite day of the year, even though it's 4/20 all month. She's due to actually introduce all of this and have the final verbiage come out at the end of April on 4/20. Other than that, guys, that's all I have for you today. Do call your congressman, do call your senator, because it is a crime, pity, and shame that testing facilities haven't reached minority neighborhoods. I don't know where to be tested. Terrence doesn't know where to be tested. You don't know where to be tested. There isn't even a site where you could research and see, hey, COVID-19 testing locations near me. It's really sad and it's quite barbaric. So are we seeing another repeat of the 1980s AIDS pandemic? I believe we are, because it is hitting African American and minority communities at a faster rate than anything before. It's hitting African American minority communities at a faster rate than HIV and AIDS did. AIDS did in the 1980s, says Politico and says the research that I've done. So stay aware, stay healthy. Until next time, guys, thank you so much. Do not forget to like, subscribe, comment. I am on Google Play, I am on Spotify, I am on Twitch. I have just been introduced to Apple Podcasts as well. And then you can also find this little guy right here on this YouTube platform every weekend, bright and early. Happy Easter, guys. Thanks for watching.